When it comes to advice about your health and wellness, sometimes it feels like there's too much information. Now, this is especially true when it comes to topics that are a little embarrassing or TMI to begin with. So what am I supposed to do about that bean I stuck up my nose when I was 5? But there's no need to be embarrassed about your health. I'm Torri, Parade's resident health question guru, and the Cleveland Clinic has equipped me with all the information I need to answer some of your medical questions. This is the TMI Show. Click on the bell so you'll be notified about every new episode of the TMI Show. Head to the comments if you have a super gnarly question you want us to answer. And if it's very TMI, you can drop us an email here. But no worries, we've heard it all. It's finally here, the very first period episode of the TMI Show. She's so grown up.
Mr. Hall, I was surfing the Crimson Wave. I had to haul ass to the ladies.
There are a ton of TMI menstruation topics out there, but today we're going to focus on when Aunt Flo doesn't show.
Flo? Has anybody seen Flo?
The word for the day, class, is amenorrhea. Amenorrhea is the absence of menstruation. There are two different kinds of amenorrhea, primary and secondary. Primary amenorrhea is what it's called when you haven't gotten your period by the time you're 16 years old. This definitely requires a visit to the doctor.
Finger prick.
The cause could be the way your body's reproductive organs were formed, issues with hormones in the hypothalamus or pituitary gland, or some other genetic or physical factor. Your doctor can help you figure out what test you might need and how to get your flow flowing. Secondary amenorrhea is when a woman who has had normal menstrual cycles stops getting her monthly period. Now, there are quite a few common reasons why this might happen, and one or two you're probably expecting. Like pregnancy.
I'm gonna be a mama too.
Pregnancy is one of the top expected causes for amenorrhea. In fact, if you're trying for a baby, a missed period is cause for excitement, not concern, and you should go ahead and take that excitement with you right on down to the doctor's office if you suspect you're pregnant. A lot of tests to take, a lot of tests.
My finger has a heartbeat.
But pregnancy isn't the only baby-related explanation for secondary amenorrhea, so is breastfeeding.
It's breast milk.
If you use some kinds of birth control, like certain IUDs, or if you stop taking birth control pills, you could experience secondary amenorrhea. And you probably already know this, but once you hit menopause, don't expect that monthly visitor to come round no more.
Get out of here.
But if it's not kids, birth control, or menopause making those periods trail off, there could be something else going on. You might be tempted to just let it go and think it's just another annoying little thing we women have to put up with.
Let it go, let it go.
But you gotta take it seriously. You're supposed to have a period. And when you don't, something is amiss.
Let's get serious. Let's get serious.
Like losing too much weight and exercising too much, or not getting enough nutrients in your diet. In fact, amenorrhea is one of the main symptoms of eating disorders like anorexia. It's very important to seek help if you think this applies to you. On the flip side, weight gain or obesity can also cause amenorrhea. Plus, if you're taking certain drugs or medications, irregular periods or no period at all may be a side effect. Make sure to tell your doctor about every prescription you're taking. Stress can also cause your periods to stop.
This is fine. I'm okay with the events that are unfolding currently.
Then there's PCOS, or polycystic ovary syndrome. When you have PCOS, your reproductive hormones are out of balance. Not only is it the #1 cause of infertility in women, but PCOS can also increase your risk for serious health issues like diabetes, heart disease, and high blood pressure. You may not have heard much about it, but a lot of women have it, as many as 5 million women of childbearing age in the US.
That's a lot of information to get in 30 seconds.
Irregular or missed periods are the most common symptoms of PCOS, along with weight gain, acne, and unwanted facial and body hair. Unfortunately, there's no one test for PCOS. A doctor will take your medical history, check your hormone levels, and perform further tests to come up with a diagnosis. In rare cases, other, even scarier issues can cause missed periods, including tumors on your ovaries. Now, this is the sentence where I tell you to go see a doctor if you suspect you might have a medical condition. Any kind of medical condition. I mean, well, basically I can fly now, so that's new. So how do you treat amenorrhea? Obviously, that depends on the cause. For some of them, there's no treatment necessary. If your period stopped because of pregnancy, have that baby.
That's right. It's a baby, see?
Sir,
Sir, you can't smoke that in here.
If your period stopped because you're breastfeeding, it should kick back in once your baby has weaned. And if menopause is the cause, well, that's just Mother Nature, and we don't mess with her.
It's not nice to fool Mother Nature.
Both extreme weight gain or loss can affect your periods. Your doctor can put together a nutrition plan to get your period back in fighting shape. And when it comes to stress, there are some stress management tips you can try yourself. It's okay to say no and set boundaries. You can practice meditation or relaxation techniques, and regular exercise always helps. But if you're stressed to the point that you're missing periods, don't just utilize the yoga mat. Take advantage of your doctor's expertise too. Your doctor wants to help find the underlying cause of your condition. Missed periods, missed exclamation points, whatever. And if necessary, they can prescribe medications, or in rare cases, recommend surgeries to get the old uterus up and running. To summarize, there are two kinds of amenorrhea, primary and secondary. Primary is when you don't have a period by 16. Secondary is when an adult woman who has had periods suddenly stops getting them. And secondary amenorrhea could be caused by nothing. That is, something you would expect to stop periods, like pregnancy or menopause, or something like an underlying illness or physical condition. And I think that puts a nice little period at the end of this episode. Think you could get more TMI than menstruation? Ask us all of your medical questions down in the comments. And if it's really TMI, send us an email at the address below. Thanks for watching.